ADHD?
So ADHD is a neurodevelopmental disorder that's often categorized into 3 cluster-like symptoms, including inattention, hyperactivity, and impulsivity. And oftentimes we see that it's diagnosed between the ages of 4 and 12. And it takes about 6 months to be able to show those symptoms to be able to be qualified for that diagnosis. It affects about 3 million children in the US currently.
A lot of kids.
Yes, lots of kiddos.
And let's talk a little bit about causes. I hear this a lot. Can eating too much sugar or food dyes cause ADHD or cure ADHD if we remove them?
Sure. So research is still very limited on this subject, although it is a very popular topic of conversation amongst parents that I work with. What we have seen is that the science has shown there is a small but significant aggregate effect of food dyes and sugars with exacerbating symptoms of hyperactivity. More research, though, is needed to really draw concrete conclusions if it's actually causal or if it's just exacerbating some effects. So it really needs more science to really back up some of those claims.
Right. So basically cutting out all sugars or all red food dyes isn't necessarily going to cause or
ADHD.
cure
Exactly.
ADHD symptoms. So just a regular balanced diet.
And obviously we always recommend that you consult with your medical professionals too with what dietary needs your child has, because every child is so unique.
Exactly, especially for eliminating things from the child's diet. All right, next question. Is there a familial link with ADHD?
Yes, so lots of research has shown there definitely is a genetic component to ADHD. And if you have a first-degree relative in your family that has the diagnosis, you're about 2 to 8% times more likely to develop the disorder.
Okay, so we know that the food dyes and sugar and diet does not cause it. So what else could cause ADHD?
So we look at the principle of nature versus nurture. And a lot of times what they show in the research is that you have the genetic vulnerability of having ADHD if it runs in your family, but also there are environmental factors. So one of those environmental factors includes having a low birth weight, having exposure in utero to substances such as alcohol, tobacco, and drugs. Oftentimes we see that if there's any postnatal injuries, you have a higher chance of developing ADHD. Lower socioeconomic status and higher stress in the household definitely can be associated with ADHD, although we don't know if there's necessarily a causal effect. Maternal depression and stress, lots of different factors. So there's too many to mention. Probably we could be here for a whole hour. But I definitely do encourage that thorough workups and history intakes are key, and also kind of formulating what is going on, because every child has so many different complex factors that contribute to behaviors. So it's important to really understand them.
Excellent. And so we're noticing that more children are being diagnosed with ADHD. And why is that?
There are many, many opinions out there as to why. I, for one, personally believe that because there is an increased awareness and there's more research being poured into this domain of study, there is definitely more information that practitioners have now to really assess and diagnose it better. So what we do see is, I think that increased awareness in science has really contributed to a lot of the increase. I will say that oftentimes there isn't a real concrete streamlined way of diagnosing ADHD. Lots of different providers have different ways of assessing and measuring. So oftentimes that can create, I think, more diagnosing of ADHD if it's not done in a thorough manner. Sometimes you do have practitioners after 5 minutes of talking to a parent, if they meet those checklist criteria on the outside, the practitioner may say, oh yeah, they definitely have ADHD. But I truly believe that a more thorough approach of really questioning the history, looking at family factors, looking at what's behind some of those behaviors before jumping to conclusions is really, really important. So I think that oftentimes that's a big contribution. There isn't a streamlined way to diagnose it.
What I find also is that parents will, when we start talking about ADHD, they'll say, wow, I have a lot of those symptoms, but I was never diagnosed, or they never told me that. And I always say, back when you were growing up, we didn't look for it.
Exactly.
But now we look for
and
ADHD.
Now we look for it. Exactly. And I think too, there are sociocultural factors to it. We do see there is a higher incidence in the US of this diagnosis compared to, for example, samples in France. And partially there's different ways of assessing for ADHD in both countries. But we also, I think that our society too makes it harder for our kiddos to regulate impulses and hold attention and develop those skills from a young age, because we are so instant gratification oriented. Mm-hmm. And children, and I think in our country, are very overstimulated with screens and different activities and expectations, and they're more pressured as well. Mm-hmm. So I think sometimes neurodevelopmentally that may contribute to some of what we're seeing. So it's just